All right. Hi, everyone, and happy National Public Health Week. It's great to have all our lovely panelists and viewers join us for this webinar, where we'll be discussing what our panelists have gained from the Public Health Museum's summer program, Outbreak. Incorporated into this discussion, we'll cover some National Public Health Week topics and also hear what our panelists have to say about them. This webinar is recorded and it's available to watch on the Public Health Museum's website shortly. And because it's a Zoom meeting, it's likely that people may start talking at the same time. And if that happens, don't worry, just pause and have one person continue answering the question, and then you can take your turn to answer. We're looking for you to all build off on each other and kind of piggyback off of others' ideas. And we just want some natural discussion. I'm excited to get into this, so let's start with some introductions. So as most of you guys in the panel know, my name is Alex Manthos. I'm a junior at the University of Michigan, and I'm originally from Easton, Massachusetts. And I'm studying math with a sub-focus in public health. And in the future, I want to combine these two things so that I can work in a field that kind of allocates finances toward public health emergencies and calculates the risk that public health crises may have on society. And actually, funny enough, I never attended Outbreak. Yeah, I really found out about the program during my senior year of high school. So by that time it was too late. So what I did was I became involved in the Public Health Museum by volunteering, and then I became a peer mentor for Outbreak in the summer of 2020. All right, so that's enough about me. Now let me introduce you guys. First, let me introduce our Olivia Morrison, our chat moderator and future Outbreak panel host. So Olivia, tell me about yourself, where you're from, what year you did Outbreak, and where you are now, whether that's in college or career-wise.
Sounds good. Hi, everyone. I am Olivia Morrison. I am from Melrose, Massachusetts. I was an Outbreak attendee in 2020 and then a peer mentor in both 2021 and 2022, kind of a little bit of helping out as a peer mentor and behind the scenes. At the moment, I am currently on a leave of absence from the University of New Hampshire School of Nursing, but I hope to be going back there this fall. And I'm excited to hear from everyone and excited to learn what everyone has been up to.
All right, thank you for that. I'm just gonna go in order of who I see on my screen. So Alana, how about you introduce yourself now?
Hi, I'm Alana. I'm a freshman at the University of Connecticut. I'm a double major in biomedical engineering and mechanical engineering in the accelerated master's program, and I'm also a pre-med. I did Outbreak in summer 2020, and Alex was my peer mentor.
Awesome, thank you for that. Claudia, how about you introduce yourself now?
Yep. Hi, I'm Claudia. I'm a freshman at Oberlin College of Arts and Sciences. I am a neuroscience major, dance minor. I hope to go into more of the private health field. I was an Outbreak attendee in 2020, and Alex was also my peer mentor.
All right, great. Let's have Hayden. You're next.
Okay, hi, I'm Hayden. I'm a senior at Natick High School in Natick, Massachusetts. I'm going to be going to college in the fall. I'm still deciding where, but I'm planning on being an early childhood education major, and I'm hoping to kind of combine that with public health and maybe work with at-risk children and figure out how to help them access public health care.
Great, thank you. All right, Seti, how about you go next?
Hi, I am a senior as well in New Hampshire, and I am thinking about going to college for biology, possibly for either research or maybe like a veterinary track, but figure that out soon enough. But yeah, I attended Outbreak in 2021 as a student, and then I was a peer mentor in 2022. And yeah, overall, I had a really great experience with the program.
Great, thank you. All right, and Nora, how about you now?
Hi, I'm Nora. I'm from West Newbury, Massachusetts. I attended Outbreak in 2020, and I'm currently a freshman at Brown University. And I haven't decided on a major yet, but I'm leaning towards neuroscience and literary arts.
Great, and lastly, Supriya.
Hi, I'm Supriya. I'm from Acton, Massachusetts, and I'm a freshman at West Point. I attended Outbreak in the same group as Nora, Claudia, and Alana in 2020, and I'm majoring in life science, trying to go pre-med.
All right, thank you all for that. It's really great to see some familiar faces, some new faces. So I'm excited for the discussion that we'll be engaging in tonight. So anyone can answer the questions first and then just kind of build off of each other. So the first question that I have, it's a super general one. Like, how was your Outbreak experience in general? And like, what do you remember being really worthwhile from Outbreak?
I can go first. So I felt mine was a little weird, but also came at a really great time because it was on Zoom. So everything had just shut down and there was kind of nothing to do for the summer. So it was a great experience to get to have. It was also really helpful in the networking aspect where you get to meet a lot of people that work in Massachusetts in different fields. And I didn't end up doing the research that I thought I was going to do my senior year, but I did end up reaching out to some people that had spoken that year. I also thought it was really interesting just to like learn about what public health is, not in like the general sense where like, oh yeah, everybody knows what that is, but like you don't really. And like just to see how many different aspects and jobs there can be within the subject.
Yeah, I kind of was in the same boat with Claudia, is that like there's nothing really to do when it was during the pandemic, and so I was like I heard of it, and then I was like, it might be a cool thing to try, because I didn't really know too much about public health other than just what I thought it was in general. But when I went into the program and I saw all of the different things that public health connects to and heard from professionals, it really changed my view of what public health was. And I think that's what I really took from Outbreak the most, was how wide of a field it is and how almost anything really can connect back to public health. And so, yeah, that's what I kind of took from it.
So when I was first presented with the opportunity to do Outbreak, I was also asked what public health was, what I thought it was, and I realized I couldn't fully answer that question, which was the main reason I wanted to do Outbreak, was to really learn what public health involves. So based off what Claudia said, like the networking was a very big thing for me. I have pretty much every guest speaker that was on our Zoom on LinkedIn still, which is pretty cool. And I can like see what they're doing, which also keeps me up to date with different things within public health. So, yeah.
Yeah, I loved working with all the different professionals because there's so many public health professionals from all different areas of the field. So you really got a nice broad overview of just public health in general. And then we wrote a paper so you could kind of like dive into your own interest in the field, which I thought was a really interesting and powerful way to engage with the field itself.
Yeah, going off of that, I was going to also talk about the paper. I think that definitely helped me just kind of learn kind of more about what I was interested in, but also like take that initiative to write like my own somewhat scientific paper, I guess. So that was definitely something good that I got out of it.
For me, it inspired me to see that public health wasn't just, being a public health nurse or just being a public health specialist, in like a city. There were a lot of different ways to be within the field. For example, as an educator, you can know a lot about public health and then have a position also within a city with that. And it showed me that there's a lot of different careers within it, other than just what you initially would think when you hear public health.
All right, yeah, thank you guys for answering that. It's really great to see your love of the Outbreak program and just how much it's helped you over the years and how we can continue the program to help other students. And Olivia, I know you're the moderator, but also feel free to answer these questions if you want to chime in or anything.
Sure, I'll just say, like everyone else said, that it was great to hear from a variety of public health professionals. Like others had said, I had a general sense of what public health was. My mom is an environmental engineer and she works in public health. So I've heard like her specific avenue, but it was great to hear from all of these different careers and all of these different things that you wouldn't necessarily think like are working in public health, like educators or occupational health nursing was something that I hadn't heard of. And it was just really great to learn about all of these things that I hadn't really heard of before. And yeah, it was just a great experience.
Definitely. And to segue into the next question, you had a perfect answer. So yeah, what way did Outbreak allow all of you to learn about public health careers and your like major that you chose, the major that you're choosing in college or you may want to study, and just careers?
So my majors, both of them are in engineering, which is not really based off of Outbreak, but one of the classes I took my first semester was health geography. And throughout Outbreak, I learned a lot about epidemiology, which was really interesting to me. So I wanted to learn more about it, and I got to explore that a lot in my class. My paper was on precision assisted suicide. So it was a lot about like medical law and ethics, which was something I didn't realize I had a passion for until I did Outbreak. Within high school, I was in a community health program within my high school. And part of that, I could explore the path of medical law and ethics. So because of Outbreak, I went to explore that. And I also have written a lot more papers on it since then. So.
That sounds like a super cool class. And I know we're trying to have an ethicist come by and speak to this upcoming year's Outbreak panelists as well, because I know there's other people who are interested in that topic, and I'm glad you got to delve more into it in college.
Yeah, I'm not exactly majoring in public health, but the program itself definitely influenced me to pick something in the health sciences area. And I also took a really cool class last semester. It was about healthcare in the United States, and it just exposed me to a bunch of different topics that I hadn't ever really learned that much about. Like it was a lot about financing and regulation of the healthcare system and like the relationship between patients and providers and payers. And it just brought a really new perspective to all of this, and tying in some of the things that I learned from my experience in Outbreak was really beneficial to my experience in that class.
I also ended up doing that. I participated in Outbreak in 2021 as a participant. And the following year, I decided to take disease and medicine at my high school because Outbreak really interested me in public health. And in disease and medicine, we covered a lot about health equity and how health isn't just about medicine, it can also be about social issues. And Outbreak really sparked that interest in me. And I don't really think I'd be going down the career path I'm going down without Outbreak.
I think for me, it kind of solidified like what I already kind of knew I liked. Like I want to major in biology, although I'm not in college yet. I think it gave me like a direction to go just because I knew just learning about all of the different ways I could go in like a career in public health because of all the applications it has. And so it kind of solidified me choosing biology because I know that it has all those applications. So yeah, Outbreak helped me a lot with that.
Yeah, so public health doesn't have a lot to do with my major, although it is intertwined in it a little bit. One of the things that Outbreak did help me see is how much research is available because of public health and how much data is collected. And that does help both in the public segment and private segment of health careers. The other things, I did also take a class last semester that was plague literature and medicine, and that was really cool. And we got to see some of the public health professionals in our county in Ohio, which was really interesting, and to see how they handle some of their issues. And then Outbreak also inspired me to get involved with the public health club at my school. So we go around and help things and like volunteer at MedWish International is a place around here that helps package used medical supplies that could be reused and help supply them to different people.
Yeah, I think all of your answers were so great. Whether Outbreak made us decide to major in public health or choose a different major career path, and then maybe study public health as like a hobby or kind of try to get into public health, a different side of public health in the future. I just think Outbreak like really helped us make some decisions on what we'd want to do in the future. Great. So let me transition into our next question now. So now, the next question I have for you is, as alumni of the Outbreak program, and also as some of you being peer mentors, what would you like to see implemented in the Outbreak program for new students?
I think it might be interesting if we, at least maybe one of the days, could do breakout sessions with panelists where, because often people aren't super comfortable asking questions in big groups, even on Zoom. And so maybe doing breakout panels where people sign up for specific panels, maybe capped at 20 attendees, where they're able to ask questions, especially if it's like a career path they're interested in. That might be really helpful, because I definitely would have during my year like to chat with the health equity presenter, but I didn't really feel comfortable asking a question in front of such a big group. So I don't know if that's something that could happen in the future, but maybe.
I know, Olivia, you mentioned that you might be doing this soon, but just like a day that's really focused on medical law and ethics, I think would be really cool. There's a lot of controversial topics, and I think that a lot of medical law and ethics is debate, and it's important to have two different sides to have a conversation about it. Like, there's not a lot of civil conversation around a lot of these topics.
Yeah, definitely always a difficult thing, like you said, to have two sides and have a fair and balanced discussion, because sometimes it deals with issues that people feel very passionate about, or are not simple issues, but definitely something important, and very cool that you took a college class on that. By the way, I'm writing down several of the classes that you guys mentioned. I'm like, I need to look and see if I can take these next semester, because they all sound amazing. But thank you for your answers.
I think it might be interesting if you looked at different parts of the country. I know most of the students and the Public Health Museum is all based in Massachusetts and New England, but over winter term, just a couple months ago, I was shadowing in Ohio, which is a very different scene than Boston or some of the places where we might have more resources. So it might be interesting to look at how public health is handled, or maybe some of the different issues that they have in less privileged areas.
Adding on to that, one of my friends, she lives in New York City right now, but she was in the Dominican Republic. And I told her a lot about this program when I did it. And it really like inspired her. And now she's doing a double major, and one of the majors is in public health.
Yeah, that's awesome. And talking about the public health disparities, I took a class kind of on that, and we just learned about how people have access to just like so many different types of like medical treatments, depending on if they live in a city or a rural area, depending on their race, income, everything like that. So I find that fascinating also. Yeah. Yeah, we can go back to the question. If whoever hasn't answered, if you want to chime in about what you'd like to see implemented in Outbreak, if you have any ideas.
Well, because I attended Outbreak like virtually, I think for me, seeing it in person would be pretty cool. So I think maybe if there was like some way where maybe like field trips, that would be pretty cool too. Like maybe to labs or to like state agency department places like that, and offices. That might be a cool thing to implement as well. But I think for the online version of Outbreak that I attended, I found it really like fulfilling in it of itself. So yeah, that's kind of what I would say about it.
Well, the good news is we are doing a kind of hybrid program this year. So we're going to have one day in person for those people who live nearby, and then for those who are coming from farther away or can't go on that day, we're going to be doing an online session. So we will have some in-person stuff this year, which we're very grateful to be able to do with the the public health and everything, public health museum and everything. But great feedback. Thank you.
All right. Yeah, thank you guys for putting in some input. The next question I have actually is about the National Public Health Week topic. So the National Public Health Week topic is centering and celebrating cultures in health. So let me just read a quick paragraph from the National Public Health Week website, and then I'll ask you a quick question. So, our cultures have always shaped our health. We learn from the communities we're born in and that we build together. For this National Public Health Week, we look to community leaders as our health leaders. We celebrate the unique and joyful ways that different cultures focus on health, and we look to how we can learn from each other with humility and openness. Now, the question that I have for you is, how do you guys think that culture shapes health or public health? There are tons of different answers, and no answer's wrong. So just give me your opinion on what you think about the way culture shapes public health.
I feel like since culture kind of like creates like an individual's mindset, the mindset kind of goes into how they may think about different health topics, and then also further how they might like respond to different health topics. So different just mentalities surrounding response and how to think about different health topics like that. I think that's how culture kind of goes into public health in that way. And yeah, that's kind of what I think about it.
Yeah, kind of going off of that, like this question made me think like of our earlier discussion about underrepresented minorities and kind of their role in public health as well. I mean, cultural beliefs and like cultural kind of stigmas around talking about health can definitely affect like how people feel comfortable about reaching out for help about healthcare, and then how they influence their lifestyle in terms of public health as well. So I think just different groups and different communities, it's very different.
Yeah, I think like Supriya mentioned, stigmas are a big part of it, and also beliefs influence priorities of what public health departments take into consideration. I know around here they're spreading Narcan kits really quickly because that was a big issue here a few years ago. But it can just like be different versus like epidemiology, drug epidemics, different things that take top priority in whichever community you're in.
And if you think about like individualistic versus societal cultures, like different people act differently in different crises. And like if you think of medical care, like the same treatment plan doesn't work for everyone. Like there's got to be some balance and some differences. So like public health responses also need to be affected by culture in this way and like be adaptive to different people's needs.
This made me kind of think of how some cultures or like religious beliefs don't agree with vaccines for religious reasons, and how we need to respect that, but also, for some public health emergencies, like COVID vaccines really are needed. And it's a part of public health where people need to think about how do we approach this in a culturally sensitive way, but also in a public health way to make sure that we're treating a public health emergency and not allowing it to continue to happen.
I think your like culture can really affect your perspective around death and illness. Can also like affect how you express pain and how you seek help too.
Yeah, I would agree. And I know, I'm sorry, I don't remember who it was, but someone brought up stigmas. And I definitely agree that there's some, groups of groups or, even some communities or some families, where sometimes talking about mental health can be, stigmatized. Unfortunately, I think there are still stigmas just in our society in general about certain mental health things. So I think that's a difficult topic that we'll need to continue to tackle as we go forward.
Yeah, really great answers, guys. It's interesting how people are brought up with different beliefs, different things that they perceive as right versus wrong, different ways to treat illnesses and what they think is the right way. So, public health and culture definitely is so intertwined, and so many people are just still studying how this affects um, different communities. All right. So if no one has anything else to say regarding that topic, I can get to our next question. So our next question is actually regarding today's topic of Public Health Week. So there's a general topic of Public Health Week, which was centering and celebrating cultures and health. But today's topic is actually reproductive and sexual health. So I'm going to read one more quick paragraph from the National Public Health Week website and then ask you guys a quick question about it. All right, so here I go. When people receive quality reproductive and sexual health care, education, and access, they can fulfill a happier and healthier life. In June of 2022, the Supreme Court overturned Roe v. Wade, the decision that guaranteed the right to abortion in the US. Since the court's decision, more than 30 states have severely restricted abortion access or banned it entirely. The lack of inclusive and accessible reproductive and sexual health care and education negatively affects everyone, but marginalized communities carry a greater burden of harm. Black women are 3 times more likely to die from a pregnancy-related cause than white women. In 2019, only 8.2% of students report receiving LGBTQ inclusive sex education, and only 19.4% of LGBTQ students were taught positive depictions of LGBTQ topics in their schools. Many healthcare facilities do not provide gender-affirming services. These biased practices put the LGBTQ community at a higher risk for sexually transmitted infections, depression, and other negative health outcomes. We must recognize structural discrimination, biases, and injustices which can block inclusive and accessible reproductive and sexual health care. All right, so that was right from the National Public Health Week website. And the question I have regarding that paragraph is, do you guys have any ideas on how we can make sexual and reproductive health not cause more harm to minority and marginalized communities? You can talk about like education, funding, anything you really think of. Let's get this discussion going.
Something that I learned in my health geography class was that so they had an HIV clinic, and they were doing studies on where each patient that went there, where they were from. And then they just discovered that almost all the patients lived at least 20 miles away because they were too scared to go to one near their house because they didn't want to be seen. So just by like studying patterns within around clinics, it could help people. And then also they found that if they didn't make it as obvious that was an HIV clinic and like kind of hid that, then they were starting to get a lot of patients from a lot nearby. So that's just, I guess, those type of studies are really important within public health and within different communities to make sure that people can get the care they need by finding how you can adjust to help them.
I also feel like investing in education and like quality education about reproductive health is very important as well, because making sure that youth are having access to like scientific and quality information, I think is really important as well, and also could help take away different stigmas and normalize understanding reproductive health. And I think because it's such an important thing, investing in education would also be very important as well.
Yeah, I completely agree with that. And I find this very interesting at a very liberal school in the middle of a not so liberal state, where we have a lot of people where you can just see the troubles that they're going through every day. Like, we live here, but we use our permanent addresses other places. But one thing that I find interesting is there's a bill that was recently introduced in Ohio, limiting what public institutions can teach, which I'm lucky enough to be at a private institution that doesn't rely on state funding as much. So we are able to provide education in the ways that aren't so much controlled by what the state says. So I think it would be a really great initiative if we could start, like, the Public Health Museum has great like educational experiences that aren't controlled by state, or if we could introduce public and free classes to people that might not be able to get them somewhere else.
Yeah, I think that's a great idea, especially in places that, might have more underrepresented minorities or more restrictive education things. I also think it's important to, make sure that whoever's teaching or whatever we're teaching it is fair and, as unbiased as can be, and, is scientifically based, but also recognizes, not everyone, whether it's cultural or religious beliefs around sexuality or abortion or anything like that, respect that other people might have different opinions and make sure it doesn't sound like, oh, there's only one right way. So obviously a difficult thing because it's a very emotional topic, and especially when you're trying to take away people's rights, that can, but it's also tricky when you're, if people with religious beliefs believe that it's morally wrong. So obviously a very tricky balance and an important topic, but I do think that education piece is so important. Just making sure, if someone's not comfortable, maybe giving them an alternative thing that doesn't mention abortion if there's very uncomfortable, or giving them scientific facts, but not necessarily, it's always so tricky because you want people to be educated, but you also don't want to tell them something that they're like, if their religion tells them otherwise, or like other people have said, the cultural beliefs around sexuality or LGBTQ, it's so tricky how to balance those things. So definitely an important topic though.
I 100% agree. And I think it's a great idea to, although it might be a little more complicated to organize more educational experiences, having options for people that might not be willing or not willing, might not be comfortable to learn about one topic, but you still want to give them education on whatever other topics you have. Yeah.
And like Olivia was saying about like education on the scientific facts behind like reproductive health, like if you consider abortions, like abortions are healthcare in many cases, and like sometimes they're necessary for the health of the person who's carrying the child. So I think it's definitely important to consider the science around all of it, and like if people are willing to learn about that and like apply that, even like if they believe something else, but like just knowing the scientific facts behind it.
Yeah, I definitely agree. And, going into some more of the nuances about like sometimes it's healthcare and these are the facts about healthcare, rather like, oh, you should, whatever, I don't want to get too political, but like, instead of like black and white thinking, like you said, getting the scientific facts and educating people about that sort of thing rather than trying to get into like whether it's ethical or stuff like that. Although that's an important thing too, but obviously it's a tricky time right now with bills and everything. And again, you don't want to offend people if they believe something different, but always a tricky thing.
I definitely agree that having like the scientific facts first being taught is really a priority. I know in Florida, there's like a lot going on right now with bans on what public schools or federally funded schools are allowed to teach around women's rights and reproductive rights, or there's like the Don't Say Gay bill, a lot of issues on trans rights. And it's hard to like for people in Florida right now to learn about the facts behind these things. And if they can't learn about it from their school, then they really need an outside resource to be able to learn these things and access to that, which I think is really important.
Yeah, all great answers. There's definitely such a fine line between like kind of offending someone's beliefs or religion, and public health. And you just kind of have to, it's hard, but it's hard for policymakers to figure out how to do this, but you just have to be respectful of other people's opinions when you're doing this sort of thing. All right, so I have one last question for you guys. I'm not sure if our moderator Olivia has any questions, but Olivia, do you have any questions, or should I ask my last question?
You can ask your last one, and I'll try to think of another one if we still have time. But you go ahead.
Okay, awesome. All right. So my last question is, what could the Public Health Museum do for all of you, like as alumni of the Outbreak program? Could it do something to help you further your career goals? Could it do something to engage you guys more in the museum? Yeah, so that's the last question.
I mean, I know I'm the moderator, but I had an idea of like other people said, getting that networking was super helpful and super important. It might be cool if there was like a Zoom event or virtual or in-person or virtual event where like you bring in some of these public health experts and some of the alumni and kind of, share talk experiences. I think that would be cool. I know like I've kept in touch with some of the people, but not all of the people. And, I know we've gotten some new speakers that you guys might not have had a chance to talk to. So I think it'd be cool if there was like a networking night or something like that to talk about, different career paths and, if anyone's looking for jobs or internships or volunteering, something like that, after Outbreak. I think that could be helpful for people.
Exactly. Like the Public Health Museum knows so many different speakers that there's so many great networking opportunities after you guys graduate college and are looking for a job or trying to apply to med school or whatever your next path is. Yeah, but does anyone else have any ideas on how the Public Health Museum could kind of help their future career goals? Or
I don't know if it's necessarily career goal oriented, but I think along with networking night, which sounds fantastic, I think it would be kind of fun to have maybe like niche interest nights. Like I know a lot of people that are like really interested in tuberculosis and just love to talk about it, and just to have like a discussion night and like meet people who are like interested in that and might be doing research in that, or like different public health topics like that might be really cool.
I definitely would love to have a night with the guest speakers and like the people that we got to meet or the other groups got to meet, because public health is always changing and there's constantly more information and more discoveries, and it would be nice to like keep up with that. And then there's just so many different topics within it, like Claudia said, that I haven't discovered yet, even ones I don't know. I would like really just love to learn more and continue learning about public health even after.
Yeah, I think it might just be really nice to be able to chat with past panelists and connect now that a lot of us are in college or going on to careers soon. Building off of what Olivia had said, doing, a night of panelists and alumni chatting and just genuinely networking and making use of the connections we've made through this program.
Yeah, I definitely agree with everything that was said here. And yeah, just having like another platform for alumni, kind of just like another outlet of meeting with these people. Because I know sometimes because presentations during the Outbreak sessions may have been shortened to like fit in with the schedule. So maybe having like not the same event, but kind of an event where speakers can have like longer sessions to talk more detailed about their topics, even more detailed than what was said. So yeah, I think just having another outlet of networking would be really beneficial too.
Or there could even be like sessions devoted to questions, because I know like a lot of the people I know like are always having these really interesting questions, and it just makes me think of a bunch of things. So I feel like since public health is such a broad field, there's so much to dive into, and I feel like hearing different people's questions could really raise different discussions. And I think that would be really interesting.
There are
Yeah.
also, I think, oh, sorry. There are people that I know that from like other countries, and I think that you guys also know people within the healthcare field that we could like have be panelists. And I think it would be cool to like be able to tell you about all the people that I'm meeting that the museum might not have a connection with too.
Yeah, it's great to hear from you guys who have some of these other perspectives that, you know, I don't have, or maybe the museum doesn't have. And I like your guys' idea about other countries, or like you said, Ohio, or even other regions that, you know, we're very fortunate to live in a place that, you know, has pretty good healthcare and a lot of hospitals in the Boston area. So I think that would be very interesting.
Yeah, I really loved all of your input on what you think the museum can do to help you guys right now and possibly later in life. Um, and also for all of you, there are so many opportunities to get involved with the museum. Just so I know a lot of us are going to college, off at college, so many virtual opportunities. And I know some of you are already taking advantage of that, which is great. Um, yeah, so that's really all I had to say. Olivia, did you have any questions or
I think we got it all. Thank you guys
yeah.
so much for coming. And I'll throw it out. We're still working on the schedule for Outbreak in the summer, but we're hoping to do something very similar to this format for the high school students. We think it'd be great for them to hear from you guys who have gone through the program and that it's, you know, shapes your careers, or that you've taken classes or stuff like that. We're still working out exactly when that's going to be, and obviously I know everyone's busy, but we'll keep you guys, we'll keep an eye out for an email for when we nail down what time we're going to try to do that panel. And thank you guys.
Yeah, it looks like we have no questions in the Q&A, so I guess we did a great job explaining everything and answering questions fully. So good job, everyone. I loved the raw discussion that we engaged in tonight, and thank you for coming.
Yeah, Alex, I just like to add